There are often many hurdles to overcome for those living with the effects of stroke, and one in particular only adds to the many physical challenges that stroke can bring. It's called spasticity. When she was in her early 20s, Francine Corso of Long Island, New York, had been a computer programmer for Grumman during NASA's pioneering days of the Apollo moon program. Francine is now 67. 18 years ago, at 49, she had a hemorrhagic stroke caused by a sudden bleeding in the brain.
I felt like somebody hit me over the head, and I really felt bad, and I feel like my head's on fire. I remember waking up in the ICU, and the doctor came over, and he told me what happened. I says, how could this happen? Keep myself in good shape. I don't have any vices. He says, well, that's your alive, lady. We didn't expect, we gave you a 10% chance of pulling through this.
With all the challenges Francine had to face due to the effects of her stroke, over time, other problems began to surface also, as spasticity began to reveal itself in her body.
The signs of spasticity, the tone, comes on 6 months to a year after a stroke.
Spasticity essentially means muscle overactivity. So in addition to weakness and loss of coordination, the arm may be curled or bent in spasm in an abnormal position.
My arm was under my chin like this. My hand was in such a fist. I couldn't have fingernails on it because any slight growth of fingernails would cut into my palm.
The circumstances surrounding Ginger Hinshaw's stroke were completely different.
I was at home and I just got this horrific headache and I couldn't see. I was real nauseated and I knew something wasn't right.
Ginger was not experiencing symptoms of a stroke, but a brain aneurysm. Her stroke actually occurred on the operating table near the end of a grueling 10-hour surgery for the aneurysm.
And I was in like a drug-induced coma for about 4 weeks. I wouldn't wake up, and they were trying to get me to wake up, and all of my friends were coming, and people from my church were coming and praying, you know, that I would wake up. And when I did wake up, I was told that I was paralyzed on my left side, that I had had a stroke during surgery.
Of course, addressing the muscle stiffening consequences of spasticity comes after dealing with the actual stroke itself. When stroke symptoms first occur, it's crucial that patients receive immediate medical attention. Experts say the best way to make this happen is for all of us to become familiar with the symptoms of stroke before an emergency occurs.
Strokes are a sudden change in neurologic status, and it can be anywhere from having slurred speech, dizziness, weakness on one side of the body, lightheadedness, or an excruciating headache.
Whatever time of life a stroke occurs, dealing with its aftermath takes a team of people to support the physical and emotional needs of patients. Medical specialists, such as neurologists and physical therapists, are an important part of that team.
Oftentimes when we treat these patients, we really focus on something called goal-oriented therapy. What is it the patient wants to be made better? They want to be able to open their hand, get their clothes on.
It's estimated that over 50% of spasticity patients have moderate to extreme limitations in handling various basic hygiene chores. Family and also formal caregivers are sometimes needed to help out.
The family unit can be a very important part of helping the patient adjust to their new limitations or new disabilities.
They have never been used to helping mom out. It's always been mom doing everything for them. You just can't imagine the things you can't do with one hand. And there's a lot that I can do, but there's a lot that I can't do. I have somebody help clean my house. And I get my hair done because I can't do a hairdryer and a round brush because I have a blown haircut. But you know, I fix my own meals and do my own grocery shopping, and I drive a car.
Well, in the first place, everything takes twice as long for me as a normal person. Like it takes me an hour to wash and get dressed, where people probably do it in 10 minutes. They don't even think about adding the time. And making my breakfast the same thing, and eating and cleaning up.
I'm not a sit at home, you know, feel sorry for me, because I've been through a lot in my life, and you just gotta fight. I just want people to have faith, because if without that, you probably won't get very far. Because my faith is what has gotten me to where I am. My faith in my God and my faith in my doctors.
Every morning when I wake up, I say, I'm going to be happy today. I don't care what happens, I'm going to be happy. I'm not going to waste the day. And every day you have on this earth is a gift, and I try to do it smiling. That's the one thing I've learned through this whole ideal, just to be happy I'm alive and to do what I can do.
Although treatment following a stroke has improved, many of its side effects can remain for a lifetime, including post-stroke spasticity. Experts agree the way to turn this around is to address the problem of stroke in general. Many of the risk factors for heart disease also apply to stroke, such as high cholesterol, high blood pressure, and a family history of the disease. To avoid post-stroke consequences, doctors encourage eating healthy, low-fat, low-sodium foods, getting lots of exercise, and having regular screenings by a healthcare provider. To answer any specific questions you may have, be sure to contact your healthcare provider.